I guess we can probably get started now. Hello, everybody. Thank you for joining today. I'm going to introduce our speaker for today, Dr. Sherry Weiser, who I've known the entire time I've been working at UCSF, so it's going to be great to hear from her. So Dr. Sherry Weiser, MD, MPH, MA, is an internist and associate professor of medicine at the Division of HIV, Infectious Disease, and Global Medicine at UCSF. Her research focuses on the impact of structural barriers to HIV prevention, treatment, and care in underserved populations in resource-poor and resource-rich settings. A large focus of her research has been on the role of food insecurity as a barrier to sustained engagement in care, adherence, and optimal health among both HIV-infected and uninfected individuals. She has led studies related to food insecurity and other structural barriers to care in Botswana, Swaziland, Kenya, Uganda, and the United States. She also has expertise in devising and evaluating food security and livelihood interventions as a way to improve health outcomes, with a particular interest in environmentally sustainable interventions. Dr. Weiser completed her medical degree at Harvard Medical School and residency training in internal medicine at UCSF. Dr. Weiser also earned an MA in medical anthropology from Harvard University and an MPH in epidemiology from UC Berkeley. So welcome, Dr. Weiser.
Thank you very much. And you know what, Shaw, I'm going to give it over to you because I think it keeps moving. So let's just switch to the next slide. Okay. Thank you all for having me speak. And so what I'm going to be doing in the next 20 minutes or so, and I'd like to keep this interactive and leave lots of time for discussion. I will start off with a focus of my career trajectory, but we'll also highlight some key pointers related to establishing good collaborations and mentorships, and we'll end with some questions and answers. You may note a lot of food metaphors throughout the talk, which you'll have to excuse me for. One of my key areas of research is food insecurity, so I thought I would just make it a little fun by using food metaphors, of which there are many, as you will see, that can relate to mentorship and collaboration. So just starting off, next slide, with my training. So I'm actually initially from Montreal, Canada, where I did my initial schooling and actually went to McGill University for 1 year before I transferred to Brown University, where I did a bachelor's in neuroscience. And that was my first entree into the research world. My first research project was very different from where I ended up. And you can see from the title of my first publication, which I will read, and I could probably barely pronounce at this point in time because I've gone in a very different direction, was stimulation of rat striatal tyrosine hydroxylase activity following intranigral administration of sigma receptor ligands. So I was very fortunate to have two wonderful mentors in my undergraduate thesis, Michael Walker and Robert Patrick, who got me very excited about research. And were even kind enough, I didn't take well to some of the things that had to be done with animal research. We were basically at the end of our experiments with the rats, we had to unfortunately kill the rats, and I couldn't do that, so my mentors would kill the rats for me, and I knew that I did not have a career in animal research because I found that very traumatic, but I did enjoy my research project. And then after Brown, and next slide, I went and spent a year in Prague. So my grandmother was originally from Prague and her family was from Czechoslovakia. Unfortunately, my family was her family was killed in the Holocaust. Definitely led to a very strong human rights orientation to my work after that. And she had passed away the year before I went to Prague, and I went there to really learn about my family history and heritage. She was actually a doctor, and she was one of the first women and the first Jewish person to attend Charles University in Prague. So I went and actually did some neuroscience research affiliated with Charles University, and also worked at the Ministry of Health in Prague. And had a wonderful year there. And when I came back from my year in Prague. I didn't know what I was going to do. Even though I had done neuroscience as an undergraduate, I was not yet pre-med. I was thinking about medical school. I was thinking about other things. And I went to take a summer course to get my organic chemistry credits in case I decided to go to medical school. I was at the University of Chicago for the summer. And I went to a career counselor, and I was telling her, I'm interested in health. I'm interested in, human behavior and culture, and wasn't sure exactly what I wanted to do. She had asked me if I had ever heard of the field of medical anthropology. At the time, I had not. And she said, there's a great program at Harvard. So this may lead to one of my lessons, which is just take risks in your career. So I just somehow showed up on the doorstep of Arthur Kleinman, who is the father of medical anthropology, and asked him how I can get into their master's program or at the time. And he said, well, you could apply in as a special student for the fall, and if you do well, you'll be able to join our master's program. So I did that, and then joined the master's program in medical anthropology at Harvard. Was very fortunate to have Dr. Paul Farmer as my thesis advisor. And that leads to another important lesson, which is try to get your mentors before they become famous. Because at the time, Paul was just an assistant professor starting out and had a lot of time to give to his mentees, which I greatly benefited from. And I did my master's thesis in Israel, focusing on tuberculosis and adherence to tuberculosis therapy among Ethiopian immigrants in Israel. And that was actually one of the first times that the concept of food insecurity came up, because food insecurity was certainly affecting adherence to the tuberculosis medications at the time. And then also as part of my master's in medical anthropology, I did another project under Arthur Kleinman with a classmate and colleague, Salman Khashoggi, where we were able to read testimonies and transcripts of hemophilia patients who contracted HIV from the blood supply in the US. And we wrote a report for the Institute of Medicine and led to this second publication. And my first introduction to HIV research. So then next slide. Following my main mentors, I decided to go to medical school at that point and was still at Harvard. So I did my MD at Harvard Medical School. Paul Farmer was still a very important mentor, and I did a number of global health projects at the time. So in my first summer, I did a project in a small Aboriginal community in northern Australia called Arakoon to understand the drivers of petrol sniffing, which was an important form of substance abuse in the region, and to create an intervention. Then during medical school, I took an extra year, and I ended up working in Botswana with Harvard's AIDS Institute for 6 months to understand barriers to antiretroviral adherence. And I think that project ended up being very seminal for me. And it sort of led me to my research mentor as a fellow, which I will get to in a little while. And then I also did the Schweitzer Fellowship in Lambaréné, Gabon, practicing medicine in remote regions of Gabon. Then I did my residency training at UCSF in the San Francisco General Primary Care Internal Medicine Residency Program, what it was called at the time, and it really focused, for those of you who don't know the hospital, it focuses on serving underserved populations, primarily uninsured populations, and it was a wonderful clinical fit, and I've never left that hospital since then. People fall in love with it, and I was one of those people, and definitely found my clinical home. And then during residency is when I met my research mentor. And just to tell a little story, when I was in Botswana, I was a medical student. I didn't have, the mentors at Harvard AIDS Institute weren't as well versed in the kind of work I was doing, so I didn't get detailed mentorship on developing my surveys. I did some qualitative and quantitative research. I sort of made up the survey, and when I came back home, and I wrote this report for the Ministry of Health in Botswana. When I came back, I decided, and was recommended to speak to some mentors here to figure out how I can publish this work. So I was directed to my mentor, David Bangsberg, who became my primary research mentor. He is a big adherence researcher in HIV and has done, very important work in that and other areas in global health. So I went to meet with him and I showed him the report, which he thought was very interesting. I showed him the survey, which he thought definitely could have benefited from more mentorship at the time. But he said, you do have some of the, first data on antiretroviral adherence in Africa. And he very kindly helped me figure out how to publish it, even though he wasn't going to be senior author. And that ended up being actually one of my most cited pieces of work, looking at the barriers to antiretroviral adherence in Botswana. And then that led to, my future trajectory. So under his mentorship, I applied for a fellowship at the Center for AIDS Prevention Studies, and I did my fellowship there. And as part of that fellowship, I did a master's in public health at Berkeley. Next slide. So just to talk a little bit about my research trajectory. So, really from medical school, all the way through my junior faculty period, my focus was largely on the social and structural drivers of HIV acquisition and health outcomes. And during my fellowship, when I linked up with David, we had decided together that my focus was going to be on mental health and HIV, and I wrote a few papers related to depression and other mental illnesses in HIV, including a review paper, and I was going to write my Career Development Award, so my K-23, on that topic. But as, hopefully, happened to many of you, opportunities arise, something catches your interest, you get excited about something, and your trajectory changes a little bit. So when I was at Berkeley, I took a course on health and human rights, and the course instructor, Vincent Iacopino, we had a very good rapport, and he heard about my previous work in Botswana, and he recruited me to co-lead this study for Physicians for Human Rights, looking at how gender inequality was perpetuating the HIV epidemics in Botswana and Swaziland. So I took that on as a global health project while I was focusing domestically on mental health and HIV. And then as part of that project, the theme came up again related to food insecurity. So both when I was speaking to participants related to barriers to antiretroviral adherence earlier, the theme of food insecurity came up as an important barrier. And then having a background in medical anthropology, when I started my research in Botswana and Swaziland, I said I would like to start with some qualitative interviews to really understand some of the key issues here. And in interview after interview and speaking with women and asking them what was driving the HIV epidemic, I remember the first woman said to me, well, women are having sex because they are hungry. If you give them food, they would not need to have sex to eat. And then another woman, for example, described her choices quite starkly. She said, well, either I starve today or I have sex with someone, get HIV, and die 5 to 10 years later. So I choose to live longer. And unfortunately, people shouldn't be having to make those choices. And that got me very interested in the concept of food insecurity and the role it was playing more broadly in the HIV epidemic. So next slide. So then I came back and actually shift the focus of my K-23 to look at food insecurity and HIV prevention and treatment outcomes, leveraging David Bangsberg's, my mentor's, a cohort there called UARTO. And then in my junior faculty time, I had other grants also in Uganda focusing on women's empowerment indicators and health outcomes. And then took the concept of food insecurity back to our work in San Francisco. So David had another cohort called the REACH cohort, Research on Access to Care and the Homeless. And we looked at whether food insecurity was driving poor HIV indicators domestically, and indeed did find very strong effects. And so that was an important focus related to HIV, both domestically and globally. Next slide. And then, as will happen to many of you, at a certain point in time, you need to transition to independence off of your K award. And it turned out that my first two RO1s were quite related to my work that I did during my K-23. So my first RO1 grant was in the Women's Interagency HIV study, teasing apart the mechanisms and pathways for how food insecurity negatively impacts not only HIV clinical outcomes, but also cardiovascular disease health. And then, along with Craig Cohen, who I know spoke earlier, and many of you know through the fellowship, we co-led an R34, followed by a second RO1, to focus on an agriculture and finance intervention as a way to improve food security and HIV health outcomes in Kenya. Next slide. And then, when you spent, during your fellowship and junior faculty period, it really is time to focus and develop some key areas of expertise and gain depth in a specific topic area. And then as you get farther along in your career, it's really fun to start branching out again. So then I moved to look at diverse food security interventions, both domestically and internationally, from targeted food supplementation in clinics and with free meal delivery programs to urban gardening interventions and livelihood interventions like the one that Craig and I are leading in Kenya. And then I moved to look at diverse outcomes of these kinds of interventions beyond HIV. So looking at diabetes, cardiovascular risk, maternal and child health, and adolescent sexual and reproductive health. And more recently, because a very important driver of food insecurity worldwide is climate change, I've also been moving both in the educational domain and in research into the area of climate change and health. Next slide. And a big focus of my work actually has been mentoring, probably one of the things I've enjoyed the most in my work. And so I currently have a K-24 award, which allows me to mentor junior investigators in the area of health disparities, and also on research at the intersection of food insecurity, HIV, and aging outcomes. And thus far, I've mentored over 50 students, fellows, and junior faculty, and this has culminated in over 70 first author publications from my mentees, 6 career development awards, and many other pilot grants. Next slide. So now I thought I would just turn, before we get to the discussion section, to some key lessons learned in this area, and each one will have a key metaphor. So next slide. So the first lesson is that the apple doesn't fall far from the tree. So having great mentors helps you become a better mentor, and I've been blessed with many great mentors. And I already mentioned Paul Farmer and David Bangsberg. And I'll just highlight Ed Frangillo, who was a food security researcher working at Cornell at the time that I recruited to work on my K, because there wasn't a lot of expertise on food insecurity at UCSF. And he's been a really important collaborator up until this day. Tor Nealons, who mentored me on statistics. And I'll just also highlight Diane Havler, who's been a very important career mentor. She was a mentor as part of the CFAR mentoring program for me, and has done a lot of important mentorship of the role of women in academics and trying to help advance my leadership in the area. So next slide. So the next lesson is don't drink the KoolAid. Even wonderful mentors don't always have the answer. So during my fellowship, I mentioned to you that my main research focus was mental health and HIV. And David, at the time, I told you, had felt strongly that that should be my area of research. So I mentioned to you that when I came back from Botswana, I was very excited about shifting my area of research to food insecurity. And David initially told me, no, that's a terrible idea. You should stick with mental health and HIV. But I thought there was something to that idea. So I went and did more reading and research to build my case, because I probably didn't make a strong enough case the first time around. And then I went and talked to other mentors, went back with him armed with a better case, and then he agreed with this direction. And then he, in fact, had joked subsequently that telling me not to do food insecurity may have been one of his worst pieces of mentoring advice yet. And I will say that I've similarly dismissed great ideas from my fellows and junior faculty when I first heard them, and I'm really happy that my fellows pushed back. So hold your ground and push back when you think you have an important idea. But I will add that importantly, along with knowing when to push back, you also should know when not to push back. I certainly have had plenty of terrible ideas that were shut down by my mentors, and it's good to know when to stop pushing back. So the next slide, please. So the next lesson is not to put all of your eggs in one basket. It's really critical to have a team of mentors. One mentor won't fit all your needs, and I strongly urge you to have other co-mentors. Importantly, other mentors also give you new opportunities that are separate from your primary mentor, and this really helps establish your reputation and develop your independence. When you get to the associate professor level, you're going to be judged by having some publications and grants separate from your primary mentor, and your co-mentors can really help with this. And I will say another related lesson is to fly the coop early, and I'll give you a personal story here. So David, my primary mentor, left UCSF when I was a first-year K awardee to go to Harvard, and it was very stressful to be a first-year K awardee without a primary mentor. But in the end, and David told me this, that it would turn out to be a very good thing for my career because it forced me to establish independence early. And so you are likely ready to take steps without your mentor before you think you're ready. Next slide. So the next lesson is bear fruit. Advocate with your mentor to spend more of your time doing things that you are judged on for your promotion. So, for instance, focus on papers and grants as PI or as co-principal investigator, because that will get you where you want to go. And I would say don't get sucked into being, for instance, project coordinator for all your mentors' studies. So focus on the things that are needed for your promotion. However, doing some of that can be good and very helpful. And I may have pushed back a little too hard on that role, and I didn't, as a result, get the opportunity to get mentored on running a team or managing a study in the same way that I might have had I co-managed some of my mentor studies. So I think some of that is okay, but make sure to spend a lot of your time doing those key things that you'll be judged on for your promotion. Next slide. So the next lesson is to know which side your bread is buttered, or know where your best interests lie, and manage up with your mentors. So as a mentee, you can help with taking ownership of and directing the relationship, have a clear agenda for what you want to accomplish, ask for feedback, manage the information flow, and importantly, address issues of potential conflict early on before they arise. Next slide. So another important lesson is to leave a trail of breadcrumbs, because your peers and mentees will soon become your colleagues. So importantly, think beyond the primary mentoring dyad to more relationship constellations. It's these complex network of mentors and peers that help you develop your academic character. And I think it is a really wise investment to focus on your peer relationships, as your peers will eventually become your colleagues. I've now written grants with at least 3 or 4 of the people that I was co-fellows with. And at this point in time, I probably work even more closely with my same level peers compared to my former mentors. And another important point, and that's really fun aspect of being in academics, is when your relationships with your mentors and mentees change over time as your mentees become your colleagues. So several of my mentees now are certainly my colleagues. I seek their input as much as they seek my input. And it's really wonderful to see these relationships evolve. The next slide, please. The next lesson is that collaborator chemistry is critical. So for instance, if you're super detail-oriented and organized, you may get very frustrated working with someone who has a looser, more disorganized style, even if they're very effective. So you may not click with every mentor, mentee, or collaborator. So I would say, in addition to the usual things you look for in a collaborator, so shared interests, someone you really respect, find someone you feel comfortable, both succeeding and failing in front of, because failing is part of our job. And I can't emphasize enough that work should be fun. We all are working so hard already. There's no room for bad chemistry. I think bad chemistry with collaborators can end up being more stressful than not getting your grants, and really does put a damper on your creative energy and productivity. So I suggest you avoid it at all costs. And finally, shared values between mentors and mentees and collaborators are critical. And I just have a few more lessons, and then we'll just open it up for discussion. So next slide. And I think one of my most important lessons as a mentor as well as a mentee is to figure out how to have your cake and eat it too, and really find win-win situations in your mentor-mentee relationships or in your collaborations. And that's really how mentoring works best. So for example, if you're co-managing a team with a fellow or a junior faculty member, and you're providing hands-on mentoring while running a study and managing a team, and you'll also get help from your mentee in running your study. If you do that, I strongly urge that you give your mentee a position that will be recognized in their promotion. And another example is first and senior authorship, which can perfectly benefit mentor and mentee alike. And again, I wouldn't keep tabs on this. Sometimes as a mentor, you're going to have to rewrite your mentee's papers so many times that the benefit is more from mentor to mentee. But other mentees will send you fantastic paper drafts with very little for you to change, and that may benefit the mentor more. And don't keep tabs. This will all even out over time. And importantly, look for colleagues and mentors that complement your skills. So for instance, I had maybe less rigorous training in statistics than colleagues who have done PhDs in epidemiology or statistics, and I always look to collaborate with people who have that strength. Next slide. And a general piece of career advice that applies to everyone is don't bite off more than you can chew. Take on projects that you know you can complete and learn when to say no. And saying no is important not only to maximize your career productivity, because if you get bogged down with too many projects, you won't be effective at them, but also to find the balance that works for your family and your lifestyle. There are many different ways to have a research career. Not all of them, involve working from 8 a.m. to 9 p.m. every night. People can do this within a reasonable time frame, and it really does relate to learning what to say yes to and what to say no to. And that means you may need to turn down important talks and important leadership positions to create that right balance. And then the last lesson, and next slide, is focusing. I talked before about how none of your mentors are perfect. And in a similar vein, realize that you're not perfect and acknowledge your own strengths and weaknesses as a researcher. And not just to yourself, but to your research teams. It's very helpful for people you're mentoring or training when you own up to your own mistakes and the areas that need work. And you have to be true to yourself as a researcher. So sometimes, while we want to model our mentors, there may be some ways that it would be very difficult for you to model your mentor. For example, if you're an introvert, don't try to model an extrovert style or vice versa. And I'll give you a personal example of this. When I think back on David, my research mentor, he really had the perfect balance of both being very approachable and also being a little intimidating to the extent that I always wanted to impress him. So as a result, when I would send him a paper, it would be really my best draft, and I would strive to use his time very well. And I did try to model this approach myself. And I got the first part of the equation okay. I think I'm quite approachable for my mentees, but clearly not the second part, because many mentees will text me at all hours and call me and send me drafts that are way too rough. So I'm still working on the intimidating part, but I also recognize that maybe I may need to do things differently. So I urge you not to compare apples and oranges, as you won't be the exact kind of mentor that your primary mentor is. And I'll just end in the last few slides, next slide, talking about my wonderful mentees who I refer to as the greatest thing since sliced bread, and this is just a few of them. Kartika Pilar, who now has a K award with NIDDK, looking at the co-management of HIV and diabetes. Alex Tsai, who's done many different kinds of work and is now starting his first R01. And his main areas of research focus on food insecurity, stigma, and mental health, and also looking at livelihood interventions. And he, has surpassed me in many ways and has, I think, more than 130 publications. Very impressive, and I'm very proud of him. Sarah Young, also doing really interesting work, has a NIMH Award looking at food insecurity and maternal and child health outcomes, and new very exciting research in water insecurity. And Nadia Diamond Smith, who has a K Award looking at gender inequality and food insecurity on maternal and child health in Nepal. And then just next slide, a few others, Amy Conroy, who was my CFAR mentee, more of a career mentee, who is doing very interesting work looking at dyadic aspects of health within heterosexual and same-sex couples in Southern Africa. Jason Nagata, who I started mentoring when he was a first-year medical student, is now an adolescent medicine fellow at UCSF and is looking at eating disorders and food insecurity in pediatric populations, and is also trying to, and in adolescent populations, and is also trying to forge a career that's combining global and domestic health research. And then Dan Kelly, who's currently a fellow looking actually at social and structural drivers of the Ebola epidemics in Sierra Leone and in Liberia. So I will end there and open it up for questions and discussion. It's very quiet.
Hi, Sherry.
Hey.
Mike here.
Hi.
Thank you for the talk. I've actually enjoyed listening. One of the things that many of us have been discussing is really the balance, and I like the way you had mentioned being able to push back, because that's a really difficult skill to learn, especially when you get feedback and you had your own track that you're running with, and you're not too sure whether you should let go of it. And as you've mentioned, even though, like for myself, I'm at the beginning of this career, but I've had a few examples of ideas that I held on to that a few years later made more sense even to my mentors, and they're willing to pick them up again. So thank you very much for sharing that. I think I really enjoyed listening to the talk.
Well, thank you. Yeah, I mean, I will say that some of it, because sometimes it's developing your own sophistication in making a coherent argument around a topic. And when you bring something up, if you're not able to convince your mentor, it's less likely that you're going to be able to convince researchers that are reviewing your grants, because you have to have very tight cases for these things. So sometimes you need more data, more reading, speaking to other mentors to really hone in your argument. And it's actually very helpful, because that process of figuring out, trying to convince your mentor why it's a good project will, help you convince your peer reviewers on your manuscripts, and will also help you convince peer reviewers that are reviewing your grants. So I agree. Sometimes it takes some time, sometimes more research, but don't give up. Just think you may need to do more work to get there.
Hi, Dr. Weiser. This is Juliet Okoro, surgery resident at UCSF. I really enjoyed your talk. I think one of the things that kind of comes up to me is how successful you have been in terms of navigating your career from the very beginning, and your experience in neuroscience and turning it out to what it is now. I wanted to know if you ever really felt alone in the process of what you were doing. So you were thinking about medical school, but you weren't exactly sure. And then you had this experience in medical anthropology, and maybe your mentors just sort of helped guide you along that path. Because I think that's one of the things that, like, I have an interest in policy, insurance, and I'm a surgery resident. And so I've been working on this topic for probably 4 to 5 years now, but I find that the surgeons don't necessarily always understand it, and then the policy people are like, what are surgeons doing in policy? So I just wonder how you have been able to kind of create that path for yourself, where there are people that you felt were influential in terms of giving you a sense of how these all kind of fit in.
Yeah, there definitely were times, and I will say, even when I was in my division, which is very clinical, starting to do social and behavioral research, I definitely felt like I was one of the only ones. And I didn't really feel like my colleagues were necessarily as interested in this line of research. So what I did was, in the end, everyone came around and has been amazingly supportive in the end. But when I started, I didn't always feel that way. And I think it was finding your people. It doesn't even have to be at UCSF. So I found some of my people at UCSF elsewhere. So I had noticed that my research was much more closely aligned with what the PhDs were doing than the MDs. And I've actually ended up probably mentoring more PhD researchers than MD researchers, although now I definitely mentor both. So I think both in terms of my mentees and my collaborators, they were distinct than the people in my division. And in some ways that ended up being very positive, that my division was my clinical home, and I loved my colleagues. I had a lot in common with them interpersonally and as a clinician, but they weren't people that I worked with. And having the people I worked with outside of my division gave me that separation of, in a way, it gave me more worlds and more communities to interact with. So I would say it's just about building your own community. And there's so many people working in health policy. And I think it's wonderful to have surgeons interested in health policy and taking a different angle. It's super important. So I would say find your colleagues, in the Health Policy Center, the Division of General Internal Medicine, where there's tons of health policy research there, and find other colleagues that could support you. And then once you are successful, you bring that back to your division and to the surgeons, and they won't say anything once you're successful.
Yeah, thank you so much for that. I appreciate it.
Hi, this is Adrienne Wynn. Thank you so much for a great talk. You mentioned the importance of establishing independence, particularly during the phase where a researcher is on a K.
Mm-hmm.
What kind of activities or things are the most important for kind of establishing this independence and becoming a PI and writing an R01?
So I think some of it is just organically happens. If you have other mentors, you end up getting involved. You want to get involved in some projects that your primary mentor is not involved with. And if that doesn't totally happen, have your primary mentor help you, or have another mentor help you establish collaboration. So I will say, David knew I was interested in food insecurity and clinical outcomes, and he had a colleague in British Columbia who had a great cohort where I could actually look at food insecurity and mortality. So he made that link, and he may have been a co-author on the paper, but he certainly wasn't the senior author. And then knowing that colleague, then I started actually mentoring one of their PhD students, and that led to lots of separate papers that my mentor wasn't on. And then my co-mentors. So just things would come up and people would say, oh, Sherry's interested in this. They would either invite me to be a co-author on a paper. They would ask me to write up papers using their data, which, frankly, everyone's always happy. If you know how to write a paper, people are always happy to share their data with you because it's less work for them if you write papers using their data. And so I think it's finding those opportunities. And if you are having trouble, don't just ask your primary mentor, but ask other mentors to help you with that. And I think it's not, frankly, I'm on the promotions committee, and I have seen people go up for a promotion who didn't have much separation from their primary mentor at the time that they became an associate professor. And if they did well and have an R01 and have lots of publications, you're still going to go up for a promotion. It's just something you want to eventually do. You don't have to feel like the second you get your K award, you have to separate from your primary mentor. You have time. It really could just be a few papers, a few projects showing that you're developing some independence.
Thank you.
And actually, the last thing I will add on that is that there is, some people even go as far as to say that the primary mentor should not be on the R01 grant. And I've actually spoken about this with a lot of different mentors and mentees. And that won't always happen, because sometimes that mentor really is a perfect fit for that grant, and the mentee really wants the mentor on their first R01 to help them, shepherd them into that next phase. So I would say there are many different ways to establish independence. Some involves complete separation and not having your mentor on your first R01. Some would involve, a longer term collaboration with them. And I think there, again, are many ways to do that.